An item seen as key to ending the pandemic is in short supply. At-home COVID tests have been hard to find, despite the White House's efforts to make them more accessible and affordable. Patrick Terpstra and our partners at Newsy take a look at why at-home COVID tests have been out of stock.
Empty shelves. Stores selling out of at-home rapid COVID tests.
It's like trying to buy toilet paper in the early part of the pandemic, right?
David Perry got the last 2 boxes at a Twin Cities drugstore. They weren't cheap either.
It's basically $50 a round for the family. That does start to add up quickly.
Pull your mask down just a bit.
You can still get tested at places like pharmacies, doctor's offices, and drive-through clinics, though appointments are harder to find. But self-tests you take at home with results in minutes are in short supply and costly. $39 for the only one we could find at the CVS in Washington, D.C. The drugstore chain is now limiting how many a customer can buy at once. Brands are back-ordered on Amazon. In other countries, same virus, different story. Plenty of self-tests to go around. 7 rapid tests available a day for everyone in the UK. Kindergartners in Israel are each getting a free home test before the first day of school. And a bin full of tests at this European grocery store. A box of 5 costing under €4. Affordable enough for David Peck to screen himself daily in Spain.
It's like brushing your teeth in the morning. You do a COVID test, you brush your teeth, you comb your hair, eat breakfast, and go.
So what's going on with the market for rapid self-tests in the U.S.? Federal health officials have long said they are important.
Rapid at-home tests that will allow us all to get back to normal activities like work and school.
But there was never demand in America like there was elsewhere.
Right now with Delta is the first time you actually see any demand for these tests. Last year, we couldn't convince places for the life of us to actually utilize these tests.
Other countries encourage frequent testing, including for those without symptoms. Governments flooded their markets with home tests, keeping prices low. Meanwhile, U.S. public health messaging centered on vaccines. Test manufacturers tell us demand tanked in spring when the CDC said fully vaccinated people did not need testing unless exposed to someone suspected or confirmed to have COVID-19.
The U.S. never really bought into the whole idea of these asymptomatic testing.
By May, with many Americans planning normal summers, Abbott had a surplus of its 15-minute Binax Now test. The company began laying off employees and throwing away test components that had expired. Across the pond, European countries were still buying billions of self-tests. When Delta hit, they were still as easy to find as a pregnancy test.
It's a real comfort. Just one measure to reduce risk.
The U.S. home testing market wasn't strong enough to handle the increase in orders amid concerns about Delta and breakthrough infections among the vaccinated. Many of the big manufacturers selling overseas lack FDA authorization to offer tests here, so they can't help fill the supply gap.
Good evening.
President Biden just announced a plan to surge production of rapid tests, sending millions to community centers and food banks for free. Walmart, Amazon, and Kroger have agreed to sell tests at cost for the next 3 months to bring prices down. But manufacturers tell us it will take time to build supply. We're ramping back up, Abbott tells us. We're hiring people and turning on parts of our manufacturing network that were idled or slowed. Australian company Illume is building a factory in Maryland to ramp up home test production 3 times over, but not till the end of the year.
Wouldn't it be great if we could all just easily take this little test? No more complicated or expensive than, I don't know, taking an allergy pill.
Already a reality outside the U.S. Patrick Terpstra, Newsy, Washington.
Abbott, the maker of the Binax Now test, says millions more are on the way. The CDC says lab testing is widely available right now, with results coming in 1 to 2 days. But lab testing faces some challenges too. The CDC says some COVID testing supplies are still in short supply, along with standard PPE and respirators. Demand for gauze and IV kits is also reportedly starting to stack up. It comes a year and a half after the pandemic began, sparking high demand that quickly drains supply. Supply has leveled out some, but faces a new test as hospitals resume elective procedures and prepare for flu season. The family restaurants forced to close because of supply chain troubles. Next on The Race.